Good evening and welcome to our 2020 Helping Children Soar virtual benefit. I'm Judith Sandalo, Executive Director of Children's Law Center. Thank you for joining us from wherever you find yourself tonight. I'll be honest, it's different looking into the lens of a camera instead of out into a crowd of 500 of my favorite people, as I've been lucky enough to do these past 20 years. But these are unprecedented times, and they require us all to make changes big and small to stop the spread of COVID-19 and protect one another. We're following the wise counsel of our honorees, who you'll be hearing from soon, the incredible Dr. Anthony Fauci and Dr. Christine Grady, who've been real-life superheroes on the front lines of this national crisis. Speaking of Drs. Fauci and Grady, as you will realize during tonight's program, I sat down with them before we learned that the President, the First Lady, and many government leaders had contracted the virus. We wish these leaders and everyone else battling the virus a speedy recovery. The rest of our program this evening will continue as planned. Too often our children, who are Black and brown and live in poverty, are forgotten as other events unfold. I hope you will join us tonight in making sure they know that their lives matter. Together, as part of the Children's Law Center community, you can help our kids and families stay healthy and recover. Usually, we start the night off with some shout-outs and celebration, and we'll get to that. But these are different, harder times. Tonight, I want to begin with a mini State of the District's children. Sadly, even before the pandemic, many of DC's children were already in crisis or teetering on the edge. 1 in 4 children were living in poverty, and in our poorest neighborhoods, almost half were. That's a family of 4 living on less than $26,000 a year. More than 13,000 DC students were contending with emotional, physical, or learning disabilities, but fewer than 10% of those students were performing at grade level. And if you were one of the 16,000 kids with asthma, you were 20 times more likely to go to the ER if you lived in a low-income neighborhood than if you lived in a wealthier part of town. None of these problems and the crises they create magically disappeared during the pandemic. Quite the opposite. Our children were swimming in stormy seas even before the pandemic. But when the floodwaters rose last March, Children's Law Center was there with lifeboats. We are no strangers to crisis. We know how to meet families where they are, to tow them to calmer waters so that they can paddle on their own. Make no mistake. Right now, many families are drowning. Job loss, food insecurity, overcrowded apartments, and grief, all compounding to increase the likelihood of homelessness, child abuse, and neglect. For nearly 25 years, day in and day out, we have fought for kids facing life-threatening dangers. What's different today is that all of us are in danger, and many of the supports our children and families have relied upon, they're not available. The pandemic has given many of us a small glimpse into the impossible choices that children and families living in poverty face every day. I am in awe of their incredible tenacity and resilience. And the pandemic didn't just magnify our individual problems, it magnified long-standing structural ones too. The pain and rage we've seen in response to the killing of Breonna Taylor, George Floyd, and so many others has been building for 400 years. Racism, still deadly, always near, is built into the fabric of our country. It distorts everything it touches, and it makes what we fight for every day even harder to achieve. I know many of our staff and clients, and for myself as the mother of 2 Black sons, it's been an emotionally draining time, to put it mildly. But here's what I also know, that if you are looking to reverse the tides of racism that have held so many Black lives hostage, there are actions you can take right now. It's a fight that Children's Law Center, with your support, has been in the thick of for decades. We know that our country's long history of housing segregation means Black families are at greater risk of eviction, so we fight for rental assistance. We've seen the legacy of racism in education, so we fought for and secured changes to school discipline laws and expanded mental health supports. We know that the disproportionate rate at which Black and brown adults, and even their children, are dying from COVID-19 is a result of entrenched disparities. So our medical-legal partnership intervenes directly in the systemic issues that jeopardize a child's health. For those of you feeling moved by this moment, or depressed, or energized, or enraged, or maybe even optimistic for the first time, I hope this evening will show you that Children's Law Center's work is racial justice in action, and you can be a part of it. Our community is facing an historic moment, one that requires the best of all of us. Before we begin our program in earnest, I want to introduce Chip Maggott, our terrific board chair, and one of the co-chairs of tonight's benefit.
Thanks, Judith, and good evening, everyone. I'm so glad to see how many of you have tuned in. Since this is a new way for us to connect, let me share a few things about how you can get the most out of your participation. And since this is a fundraiser, how you can easily support Children's Law Center. On the screen, you will see our program for tonight. The event will run until about 7:15. Please note that there are 2 segments this evening with our honorees, Dr. Christine Grady and her husband, Dr. Anthony Fauci. So make sure you stick around until the end. As Judith just shared, these are hard times for far too many families and children. Tonight, you'll learn more about how you can make a direct impact on their lives. For those of you that are moved to give or give again, I want to make sure that you have our donation options at your fingertips. We have 4 easy ways for you to make a gift or pledge. First, you can click the red donate button in the top right-hand corner of your screen. Or you can text DC Kids, that's DCKIDS, to 44321, that's 44321, to receive a donation link on your cell phone. You can call 202-467-4900 and then dial 7 so a team member can process your contribution or pledge over the phone. Or you can email a pledge to outreach@childrenslawcenter.org. If you have questions or run into any issues, please email outreach@childrenslawcenter.org. What's more, any gift you make tonight will be doubled by one of Dr. Grady's and Dr. Fauci's grateful neighbors and a longtime supporter of our work. That means your donation will have twice the impact. It also means that you'll receive access to our exclusive second night on Thursday, October 8th, where Dr. Fauci and Dr. Grady answer your questions, and our post-event Zoom receptions tonight and Thursday night with Children's Law Center staff, each beginning around 7:15 p.m. Now, I'm delighted to introduce you to Diana Goldberg. She's a valued part of the Children's Law Center family. She and her husband, Stephen, co-chair our Children Can't Wait Fund, and were the inaugural donors who launched our medical legal partnership. She was a board member of the Washington AIDS Partnership and chair of the Children's Hospital Board of Directors. As the leading philanthropist for children's health in DC, Diana will introduce you to 2 people whose work has been a model for us on how to fight ethically and effectively for the health of DC's children. Diana?
Thank you, Chip. I am honored beyond words to present our 2020 Distinguished Child Advocate Award to Drs. Anthony Fauci and Christine Grady. They are the embodiment of what our country and the world needs right now: medical expertise, honest communication, a deep appreciation for ethics, and a commitment to the well-being of our entire community. I am confident everybody watching tonight knows Dr. Fauci. He has been our trusted guide throughout the current pandemic, giving accurate and honest information to all of us, leading the work of experts within NIH, and managing a complex political situation. What you may not know is that Dr. Fauci has guided 6 presidents through many epidemics, leading research and responses to the AIDS crisis, Ebola, and SARS, to name just a few. I am delighted to introduce you to Dr. Christine Grady. She is an equally accomplished medical and public health leader, though she may grace our TV screens less often. Early in her career, she worked as a nurse for patients with HIV/AIDS. She used that expertise to become an outspoken leader and thinker on issues related to ethics and AIDS, and in recent months has turned her attention to ethical issues related to the development and distribution of a COVID-19 vaccine. I could talk for an hour about the impressive careers of each of these extraordinary people. The work they have done over their lifetimes has saved the lives of countless children and families in our community and across the globe. Tonight, we honor them for leading us through the COVID-19 pandemic. caring about all of us, regardless of our race or our politics or our socioeconomic background, and taking steps to address the inequities that the pandemic has laid bare. Fitting that they are being honored by Children's Law Center, an organization that embodies the same combination of expertise, compassion, and laser focus on smart solutions. Dr. Grady and Dr. Fauci, your lifelong work and your service during this crisis have shown both what is at stake and what is possible in this moment. I thank you deeply on behalf of all of us at Children's Law Center for working to heal a sick and hurting nation and for lighting the way forward. We are more grateful than I can ever say. Thank you so much.
Good evening, and thank you so much to the Children's Law Center and to Diana. It's so great to be here. It's a wonderful honor to receive the 2020 Distinguished Child Advocate Award from the Children's Law Center, and to receive it along with my life partner here, Tony Fauci. Thank you so much to everyone who supports or works with the Children's Law Center and supports the goal of helping children soar. In my own work, I have the opportunity to work often with children who have serious diseases and conditions which sometimes challenge their quality of life and the length of their life. I'm constantly struck by the courage and the wisdom that these children exhibit and the way they teach us about life. I also have noted many times that the stable family, good education, and good health are often intertwined. And in my own work, again, the best example of this is you notice that children face the challenges of difficult diseases and health conditions much more capably when they have the support and the love of a stable family behind them. I applaud the efforts of the Children's Law Center in seeking stable and loving homes for children in D.C., especially disadvantaged children in the District of Columbia, for helping to create interventions and structures for good quality education for children across the board and for teenagers, and for helping to mitigate the risks of asthma and violence and mental illness and other health risks that children face on a daily basis. It's a wonderful organization that does wonderful work. It is humbling, really, for me to receive this extraordinary award and to do so with Tony, and to also be listed on the list of the all-star previous award winners. So thank you so much for this honor.
I want to reiterate the words of my wife, Christine, in expressing our gratitude and really feeling humbled to have received this award of the 2020 Distinguished Child Advocate Award from the Children's Law Center. And I want to thank the organizers for the extraordinary work that this center does. Everything that Christine said about the importance of a stable home environment, about good health, and about opportunity for education, particularly among people who live in poverty, it really triggers me to say something that I really appreciate the opportunity of saying. I'm a physician, but I'm a physician who generally takes care of adults. And very often when I'm dealing with diseases that go back to HIV in the 80s, to Ebola, to Zika, and most recently what we're dealing with right now, namely COVID-19, there's a particular aspect about that that really links to what the Children's Law Center stands for. And that is the extraordinary and painful disparity in both risk of infection and consequences of the severity of infection among a certain subset of people. And I'm talking about brown and black people, individuals who, as adults, when they get infected, even putting children aside, we're trying to figure out why they do so poorly. And we talk about things that we can handle immediately by greater access to health or putting more money into situations of getting them tested. But we always get back to the long-range things, and that's the social determinants of health. Things that I have said publicly are not going to be fixable tomorrow or the next day. It's going to take decades to fix that. And when you think about the social determinants of health, why children, and then children become adults, and then adults have certain underlying conditions that go way back to things that are influenced by stable home environments, by the accessibility to quality education, to accessibility to good health practices, particularly when they're living in poverty. What I think about the solution now, when I talk about it, I'm going to be talking about things that the Children's Law Center have devoted their entire efforts for, is to have an influence at a very early age when we're dealing with children, so that when I, as an adult physician, see things that could have possibly been corrected if things were done well when these adults were children. And that's what the Children's Law Center stands for. And for that reason, I feel particularly proud and humbled to receive this award. And again, particularly to receive it with my wife, Dr. Christine Grady, who is a much underappreciated factor in so many of the things that I do and that is done in the field. So thank you again.
Thank you, Drs. Grady and Fauci. We look forward to hearing more from you very soon. It is such a privilege to be able to honor both of you, and we are delighted to have you with us for this year's Helping Children Soar benefit. My name is Stephanie Hales. I am a member of Children's Law Center's governing board and chair of our advisory board. I also am a co-chair of this year's benefit. I am excited to have the opportunity to thank many of the people whose generosity and support have made tonight possible. First, I want to start with a shout out and heartfelt thanks to members of CLC's advisory board who raise more than $1 million each year to support Children's Law Center. Next, a very big thank you to my fellow benefit co-chairs, Chip Magid, who you met earlier this evening, and Melissa Wiley, who chairs our emeritus board. Thank you as well to our wonderful vice chairs, Fred and Jill Klein, and our amazing host committee, who went above and beyond to raise much needed funds and to bring a number of you watching this evening into the Children's Law Center family. Now, I'd like to take a moment to thank some of the incredibly generous donors who have sponsored this year's benefit. We greatly appreciate their support, which has truly been a lifeline during this year's challenging times and the ongoing crisis. Our visionary sponsors, Covington and Burling and Latham and Watkins. Our champion sponsors, Jewel Cahill Kreider and Greg Kreider and the Magic Vermont Foundation. And our pioneer sponsors, Aiken Gump, Arnold and Porter, Denton's, Jill and Fred Klein, Chip and Vicki Magid, the Marsh Law Firm, Mayor Brown, Ropes and Gray, Sidley Austin, and Staten. We would be here all night if I thanked everyone, but you can find the names of all of our wonderfully generous supporters by clicking on the Sponsors tab at the top of your screen. We are so very grateful for all of you. Before we move on to our conversation with Drs. Grady and Fauci, I want you to meet the Jurados, one of the families we met during the pandemic, and Janine Tillery, a lawyer with Children's Law Center. Their story reflects why so many of us work so hard for Children's Law Center.
Thanks so much, Stephanie, and good evening, everyone. I've been a part of the Healthy Together team since 2012. Healthy Together is a pioneering medical legal partnership that embeds our lawyers in 6 health clinics around the district to help pediatricians and families find and fix the root causes of a child's health problems. Our team steps in whenever a child's poor health can't be fixed by medicine, like mold that leaves a 10-year-old struggling to breathe. It's a heart-wrenching situation that I've seen far too many times. And often parents who are trying their hardest to protect their kids are blocked by obstacles beyond their control. A landlord ignoring their pleas, an insurance company refusing to cover a necessary medical expense, an overburdened school system unable to prioritize their kids' special needs. Our team steps up to help families remove these obstacles and clear the way for a child's success. In doing so, not only do we help children lead happier, healthier lives, but we save taxpayers hundreds of thousands of dollars a year. I'd like to introduce you now to one such family. We met the Gerardos during the pandemic. Like so many parents, Mr. and Mrs. Gerardo were doing their best to give their sons Elmer and Jonathan what they needed to be safe, healthy, and learning. But they were struggling. Their landlord wouldn't fix housing problems that were making the boys sick, And then Ms. Gerardo caught COVID-19. For so many families, these moments can be a breaking point. Children fall further behind in school, unaddressed health issues compound, stress and trauma build up. These are the high-stakes moments when Children's Law Center can help parents solve problems and prevent a crisis so they don't have to carry the burden alone. Because if this year and all of its challenges have taught us anything, it's that we can't do it all alone. We all need help. We all need an advocate. We all need a support system. But too often, we ask families living in poverty to figure it out on their own, to navigate complicated systems that are riddled with dead ends and stumbling blocks, and that magnify all the ways racism and poverty already shape outcomes and perpetuate disparities. But it doesn't have to be this way. Take a look at what we can do together.
Before and during the pandemic, Mrs. Jurado was cleaning her home every day. Her family's apartment had serious mold problems caused by humidity. And no matter how much they cleaned with Clorox or ran dehumidifiers, the apartment walls were still wet to the touch. And worse, the mold was making her kids sick and giving them rashes.
Eso lo descubrí después que yo enfermé de COVID. Pues tuve que encerrarme en el otro cuarto sola. Como estuve encerrada casi un mes y medio casi, como eso se descuidó durante mi enfermedad, es cuando el moho empezó a crecer bastante y ellos empezaron a presentar el salpullido en su piel.
The mold and humidity were so pervasive that after only one day, the children's mattress began to rot. So Mrs. Jurado called her landlord repeatedly. She documented in impressive detail every wet surface, every mold growth and crack in the walls, and she sent them. And the landlord just refused to make the repairs, even though the law requires it.
Esos días que estábamos más peor con la pandemia, yo hice la cita, su doctora los vio por videollamada y vio como ellos estaban llenos de su cuerpo, de las ronchas. Tuvieron mucho medicamento, incluso Elmer todavía está con ese medicamento.
A pediatrician at a local community health center referred Ms. Gerardo to Children's Law Center. And although the city was shut down because of the pandemic, Children's Law Center had figured out how to investigate and advocate remotely. Kate and one of our investigators used FaceTime to see the extent of the damage and figure out the best path forward. Because the conditions were getting worse and the pandemic kept the family inside, we knew the boys wouldn't get better without immediate action. The landlord needed to make repairs as quickly as possible.
So I contacted the building's representatives, listing out all of the dangerous housing conditions, concerns Mrs. Jurado had raised with them many times. I then filed what's called a demand letter, which notes all of the housing code violations that the landlord made and what they need to do to remedy each issue. And thankfully, we didn't have to go to court for the housing conditions, but we didn't take the landlord's word for it either. We made sure that all of the repairs were made.
Fue rápida la respuesta después que ustedes nos empezaron a ayudar, la organización de ustedes empezó a ayudarnos, las respuestas llegaron rápido. Se siente mejor porque incluso es que ya después que arreglaron su cuarto, compramos sus nuevas camas, ya comenzamos a traer todos sus muebles nuevos porque todos los tuvimos que tirar a la basura porque se pudrió todo totalmente. Entonces ya ellos ya están más felices de estar cada quien en su cama, ya no dormir en camas inflables.
As Kate got to know the family, she also learned about Elmer's love for his service dog, Junior. Elmer's mom and dad noticed he was having difficulty keeping up in school and had a hard time connecting with his classmates. His service dog helped him connect, but the landlord refused to let Elmer keep his dog. We knew the family had a legal right to keep Junior, and they already had all the paperwork they needed from doctors and social workers. For 12-year-old Elmer, our legal work quickly became not just about his physical health, but about his emotional health too.
Good evening, everyone. My name is Chiquita Brooks-LaShore, and I proudly serve on the governing board at Children's Law Center. As a mother, watching Mrs. Jurado tell her family story made me sick to my stomach, just thinking of my child in pain that way. I think about how scary this time has been, being apart from loved ones, the stress of working while balancing virtual learning. And yet, at the end of the day, I've been able to tuck my daughter into bed at night, knowing that if she faces a problem with her health or education, I can call upon every resource at my disposal to get her help. That's all we can do as parents, call upon every resource at our disposal to protect and help our children. But that's the problem, isn't it? We all have very different resources to call upon. It is not right that a child's future depends on their parents' wealth, that some of us have the resources to move mountains, while others are just trying to find their way to higher ground. Mrs. Jurado, I am so glad that your boys have you and your husband, and I'm also glad that you have Children's Law Center. The sad truth is that too many of our children still need our help to live in a house that doesn't make them sick, to access the school supports they need to learn, to find stability and love in a forever home. 5,000 children and families turned to us last year, and thousands more will need our help in the months and years ahead. They simply cannot do it alone, and neither can Children's Law Center. We need a team that includes you. So please, whether you're tuning in for the first time or a longtime supporter who's already given, I hope you'll dig deep right now and make a gift or a pledge in support of DC's kids. You can click on the red donate button. You can call one of our team members, and you could email a pledge to outreach@childrenslawcenter.org or text DC Kids to 44321. And don't forget that giving tonight means two things. One, your contribution is doubled thanks to a generous match. And two, you'll get access to an exclusive second night of our benefit featuring a candid Q&A with Drs. Fauci and Grady. I'm asking you on behalf of all of the kids and parents who really need a problem solver right now to make a contribution that makes you a little uncomfortable, whatever that means to you. For me, that meant doubling the annual gift my husband and I make. For you, it may mean pushing yourself from $150 to $250 in order to help a teen get the mental health services he needs remotely. If you can increase to $500, we'll be able to get a toddler speech therapy so she can say mama for the first time. And if you step up right now and join our Kite Club with a gift of $1,500, you'll help us reunite a child with his mom. So please dig deep, whatever that looks like to you. We can let our community's children fall through the cracks, or we can help them soar. It is entirely up to us. So while you're making your gifts, I'm proud to share that my church, the Alfred Street Baptist Church, is standing with Children's Law Center. Our congregation donated $20,000 so that Children's Law Center could buy thousands of see-through masks. Not only will they ease some of the communication barriers facing the deaf and hard-of-hearing communities, clear masks may also provide a safer option for Black men and boys who are often stereotyped in our society. I don't want to stop you from donating, so please keep at it. But while you're clicking on links and filling out your information, let's return to our honorees, Dr. Fauci and Dr. Grady, who graciously sat down with our executive director to tell us about their impressive careers and discuss the pandemic.
Thank you so much for inviting us into your backyard. Dr. Fauci, it's a great pleasure to sit down with you again. We sat down together to talk 3 years ago, and sadly at that time, you said we were going to face a pandemic, and unfortunately you were right, and here we are. Dr. Grady, I'm looking forward to getting a chance to know more about your work and career. It's so impressive, but we all don't get to know about it. So let's just jump in and have a conversation. The pandemic has caused many young people to decide that they want a career in science and public health, and the two of you are role models. So if you don't mind taking a minute, Dr. Grady, to talk about how you started as a nurse
And Dr. Fauci, your decision to become a doctor.
Sure. So from the time that I can remember, I was always interested in science and helping people. I was like the kid in the neighborhood that everybody ran to when something happened and they needed help. And when I was in high school, I think that the obvious choice for a woman of my age in that era was to become a nurse. And so I did. I love being a nurse. It's a wonderful profession. It gives you the opportunity to have intimate relationships with people who are very vulnerable at the time that you get to meet them. And you can offer some things that actually help them get through what they're struggling with at that time. I once read that, one of the wonderful things about being a nurse is that you learn about people at the beginning and the end of life. You open the eyes of a newborn baby and close the eyes of an elderly gentleman who's dying. And those are things that I've had the opportunity to do. So it's a great profession and a wonderful place that I started in mine. Now I moved on to bioethics. I don't know if you want me to go there, but I noticed many things in my career as a nurse, things that I couldn't quite figure out what the right sort of way to go was. And I decided after many years and a lot of wonderful experiences as a nurse that it would help me to get more education and to sort of move into a place where I could navigate some of the complexities of delivering care and research.
And so to become an ethicist, what additional education did you need?
So I got a PhD in philosophy, and so many bioethicists are philosophers. Many of them are also lawyers, and some are clinicians, and some are theologians, and some are social scientists. And one of the wonderful things about bioethics, from my perspective, is the rich interdisciplinary nature of it. And so lots of things. My particular degree is PhD in philosophy.
Interesting. And Dr. Fauci, how did you come to be a doctor?
Well, I think we need to distinguish being a physician versus a physician scientist, because it was sort of an evolution in my life and my career. If you talk about why I wanted to become a physician, I didn't really know that I wanted to do that early on, but I did notice fundamentally from the theme or spirit in my household of my mother and my father, which was particularly geared towards service to the public, in the sense of not really worrying about material things, but more what you can give to society. I mean, I had that in my environment from the time I was a child, so it's no credit to me. It was just lucky enough to be born and raised in a family which also was propagated and amplified by my education. So I went to a Jesuit high school and a Jesuit college, and particularly in high school, where the Jesuits instilled in us the theme was service for others. It was an all-boys school, so they would say men for others was the theme. And it was mostly a classical education, Greek, Latin, history of civilizations, philosophy to a certain extent. I got a lot more philosophy in college when I went to Holy Cross, also a Jesuit college. But at Regis High School, I really had a great affinity for being involved with the humanities and dealing with people. And simultaneous with that, I knew that what I was going to do had to be involving people. And then when I started to get involved with the simple science classes in high school, I realized that I really liked it. And I was pretty good at it, which was interesting. So I was saying to myself, how do I combine this idea of science and biology with wanting to be a people-oriented profession? So to me, it became clearly obvious that that was a physician. So when I went to Holy Cross, that was even more amplified because my education at Holy Cross was very unusual. I would call it a hybrid education because I had a degree that is almost oxymoronic in its words. It was Bachelor of Arts, Greek Classics - pre-med, which means that you studied, philosophy, the Greek history, Iliad, Odyssey, Latin, Cicero, and Ovid, and all that sort of stuff together with enough science courses to get you into medical school. And that's what I am. So I'm a physician who's much more of a humanitarian component than a basic science physician, which someone who would go for an MD, PhD knowing they want science. My affinity for science came later, and that was something almost serendipity, where I wanted to get further training in infectious diseases and immunology. So I went to the National Institutes of Health, and there I got exposed to what was, a kid in a candy store of science, which was the best of the best in the world, exposing me to science and what the scientific method is. And in that environment, I developed this feeling, which is where I am today, that I wanted to be a hybrid. I wanted to remain a physician with a very strong connection to people and people who have diseases that I can help them with. At the same time as science, which I found out that I really liked, and I was pretty good at it, so therefore I combined them. So really what I am right now is I'm primarily a physician, but I'm a physician scientist.
And it's clear that each of you brings to your careers both a love of people and a love of science. How as a professional, as a couple, each of you with your own separate and distinguished careers, how has being a couple changed or strengthened your careers?
So it's a great partnership. In the work that I do, I'm a bioethicist who works in areas that are very adjacent to science, and so I need to understand science well enough to be able to make, have opinions about what the bioethics, the ways to go, ways to approach bioethics and how to resolve certain issues. And so I think our partnership allows me to, in a natural way, because our interests overlap, to have conversations in, informal settings and over dinner or on walks on the canal or in the neighborhood to really sort of ask Tony, here's how I understand this particular aspect of science. Is that right? Or to probe him with questions about things that are not clear to me or that I've read and have to challenge in terms of, whether they make sense or not. So we do have those kinds of conversations quite frequently, right?
Oh, absolutely. And I've benefited greatly from this partnership of overlapping interest and common interest. So a lot of the things that I do with regard to development of vaccines, the development of therapies, being involved with outbreaks and pandemics have ethical overtones to them. And I can say that I am very, very blessed to be living with someone who is very likely, most people think, one of the most outstanding ethicists in the world. So to have her in the house, as a consultant on ethical issues is pretty advantageous. The other thing that goes beyond ethics is she has fantastic judgment in the ability to analyze something. And when I am going around in circles trying to figure out a particular area or issue, there are maybe 2 or 3 people that I deal with, that I go to really trust their judgment. And Christine is right at the top of that very, very short list.
Well, let's talk about one of those issues which everyone is thinking about right now. So obviously, the pandemic is where most people's minds are. And people are talking about whether we should be opening schools or not opening schools. On one hand, everybody can see that there are children who aren't learning, whose mental health is harmed by not being able to be in a school setting. Parents are struggling to be able to go to work, not leave their kids alone. But on the other side, none of us want kids or teachers or parents or anyone in the community to die and to be harmed by COVID. How do you, as an ethicist, as a public health expert, how do you think about those competing risks and give advice on that?
So there are some fundamental principles that really guide when I give response to or advice to questions about schools. So first of all, the default position in the context of COVID-19 is that we should try as best as we possibly can to get the children to go back to school, because it's very clear that keeping children out of school ultimately is deleterious to them. Mm-hmm. Then there's the question of the balance, and it is not one size fits all. So what I say is, if you look at the country, the United States, from an epidemiological standpoint, You break it down into green and very green zones, yellow, orange, and red zones, indicating the level and degree of infection in the particular area you live in, what particular city, state, county, locale. And you really got to use your judgment that with the background default position of always trying as best as you can to get the kids back to school, you've got to realize that living in a green zone or an ultra green zone in which the infection test positivity is extremely low, with really relative impunity, you can get the kids back to school as long as you have some system in place to be able to deal with what happens when a child gets infected. Do you know what to do? Are you aware of the CDC guidelines? When you get into the yellow zone, you may need to do things that are a little bit more, I wouldn't say restrictive, but are a little bit more proscriptive, like think about maybe indoor-outdoor classes. Think about hybrid, part online, part in person, separation of desks if possible, good aeration in the classroom if you could possibly keep windows open depending upon the climate, wearing of masks, protecting the vulnerable teachers who are at a certain age with underlying conditions. As you get into the red zone where there's a high degree, then you got to really consider. That doesn't mean you can't open the schools, but you better have a system in place that pays attention in any respect, whether it's green, yellow, red, to the health and welfare of the children themselves, of the teachers, and the people who come into contact with them. So that means that there's no one answer to that, except you should all be driven by the ultimate goal of getting the kids back to school.
This is a great example of an issue that's laden with ethical questions, because what's driving the decision is what's in the best interest of the children, and the best interest of the children also extends to their families and their communities. And so trading off, how to protect them from COVID with how to protect them from the, as Tony said, deleterious effects of not being able to go to school in terms of isolation and learning and all the other things that go with that, is a very important decision and needs to be made in a contextual way.
And perhaps I should have started with this question, which is, the science has been evolving about how children are affected by COVID. What do we know today, or what don't we know?
Well, it is an evolving question, and I think we need to be humble that as we get more data, you may change. We do know, first of all, that children can and do get infected. That is a fact. The extent, the ease to which they get infected or not is still depending upon what the latest data coming out. So you got a heads up that may change. Number two, it is clear that children, the ultimate effect of the virus on them, when you look at hospitalizations and deaths, comparing a child, and you look at the bar graphs that go in different age brackets, 0 to 5, 5 to 17, 17 to 20, blah, 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 and you go all the way up to 85 plus, it looks like this, which means the older you are, the higher degree of hospitalization rate per 100,000 populations. So it is a fact that children do better with regard to hospitalizations and death. Very few children die. That we know. What we don't know is what the long-range effects of this virus are, because we do know that people who do get clinically ill can have a lingering degree of symptomatology. I hope that a child who gets no symptoms at all, when that virus is cleared, there won't be a long-range effect.
Given that state of the knowledge, what can local governments do to help create a situation in which we can open schools?
Well, to me, I get asked this question maybe 10 times a day, usually in public. And the answer is the easiest way to get children back to school safely is to look at the zone that you live in. When I say zone, I mean, do you live in a green zone, a yellow zone, an orange zone, or a red zone? So if you live in a red zone, as a community leader, the best way to get the kids back to school is to do everything you can to get your city, county, town from red to yellow to green. That's the best way to do it. And you do that by some pretty simple public health measures, is that by careful and prudent adherence to the guidelines that we on the White House Coronavirus Task Force have put forth months ago. Namely, take a look at your community. You have a gateway, you have a phase 1, phase 2, phase 3, and don't hop over them, but to do it in a prudent, careful way. And there are 5 or so things that one can do that should be universal. Universal wearing of masks, keeping a distance, at least 6 feet or more, avoiding crowds, doing things outdoors much, much more preferably than indoors, and washing your hands as frequently as you can. They seem rather simplistic, but we know where that has been implemented, there has been a blunting of the surges and even a prevention of the surge. So if you want to help out at the local leadership level, do common, good, prescribed public health measures.
I agree with everything that Tony said. The one thing I would add is that at the local level, I think it's really important for the school districts or each school maybe to communicate with the parents and to really have some ongoing engagement about what they know and what they're going to be doing when the kids do come back, because these things that Tony mentioned, which are straightforward, masks and physical distancing, are not trivial for children, and especially for young children.
And before we get to vaccines, because we asked our supporters what questions to ask, and they all want to hear about the vaccine, but before we get there, and Dr. Grady, for you in particular, what are some of the ethics issues that we should be, other than schools and vaccines, that come up in the pandemic that we should be thinking about?
So there are so many ethical issues that the pandemic raises, starting with clinical issues that got a lot of attention in the beginning, and that was acceptable ways to allocate scarce resources like beds, ICU beds, protective equipment, personal protective equipment, ventilators. Got a lot of attention, and many states put in sort of policies for how they would do that kind of allocation, and a lot of them engaged members of the public to try to make sure those were acceptable.
Can you take one of those ethical issues and just walk us through how, as an ethicist, you think about making that decision and giving advice?
Sure. So, let's take the allocation of ventilators as an example. Certainly in the ethics literature, there are long-standing principles of allocation, fair allocation, that focus primarily on saving lives. But then there are, once you get past that, there are lots of debates about what else matters. So saving lives might even be, the most number of lives, the most number of life years, the most quality life years. There's a lot of dimensions even in the saving lives part. But the second usually accepted second principle of allocation is fairness and, being attentive to the kinds of disadvantages that some people face. And so lots of debates about whether or not people who are disadvantaged for whatever reason should get extra weight in the allocation discussions and frameworks.
So everyone is thinking about a vaccine. And I know it's not the only issue on the table, but so many people are asking questions. So starting with your scientific and public health and ethics hats, can you talk a little bit about the questions that are going to come up as we think about distributing the vaccine?
What a privilege to talk with Dr. Grady and Dr. Fauci. I had a chance to ask my questions, but don't forget that Thursday night they'll be answering yours. For now, let me just say thank you for being part of this work. From the Goldbergs to the Alfred Street Baptist Church to all of you watching right now, I have confidence that our community will be here, ready to answer the call from children and families in distress, and that we won't let any child get swept away in this crisis. I hope you'll join me and some of my colleagues now with the Zoom link you should have received by email if you've already made a gift. We'll be sharing more about our work and answering your questions. If you haven't donated yet but don't want to miss the after party, use one of the options on the screen to make a gift, and you'll receive a link instantly. In doing so, you'll also receive access to Thursday's Q&A with Drs. Fauci and Grady and hear a surprise announcement about a future honoree. Stay safe, stay healthy, and I'll see some of you in a moment.